Welcome to the Cleveland Clinic South Pointe Orthopedic Surgical Residency educational video series. This series was created for educational purposes designed to aid in patient care and teaching proper steps and techniques for commonly completed bedside orthopedic skills and procedures. In this video, we will provide a demonstration on the proper technique for completing a knee arthrocentesis for effusion. This should always be treated as a sterile procedure, and thus the necessary supplies should be gathered as shown. You will need a means of sterilizing the aspiration site. An alcohol swab, chloroprep, or betadine should be used. Additionally, you will require sterile gloves, a sterile cap for the sample, as well as a lavender tube, which may be useful in preventing a clotted sample in the instance of a bloody aspirate, an 18-gauge needle, 4x4 gauze and Band-Aids, a specimen bag, and lastly, a 10 cc or even 5 cc syringe for obtaining the sample. This is an important point as utilizing a larger syringe initially can create excessive negative pressure, which can be counterproductive in obtaining fluid as it can lead to soft tissue, occluding the needle tip. At least one 30 cc syringe should be available to switch out carefully, leaving the needle in the knee throughout the procedure. Additional 30 cc syringes should be available depending upon the size of the effusion. After obtaining consent, begin by marking the necessary landmarks. The desired site for entry is approximately 1 centimeter proximal and lateral to the superior lateral corner of the patella, as shown and drawn out. Create a wide sterile field beginning at the aspiration site, sterilizing outward. In this demonstration, chloroprep was the solution of choice. Towels or the contents of a laceration kit can be of benefit in maintaining a sterile field. After fully prepping the field, don your sterile gloves. Check your desired entry point. Once more, and in a controlled fashion, enter the knee aimed towards the suprapatellar space. Avoid dropping or raising your hand excessively to avoid encountering bone or cartilage. Upon entering the suprapatellar space, you will often get return from the pressure created by the effusion itself. As you enter the space, pull back on the syringe while maintaining a steady hand. Once you have collected a sufficient specimen through the necessary number of syringes, remove the needle from the knee in a controlled fashion and place a Band-Aid or gauze over the entry point. If planning to utilize a lavender top tube, do so at this time. Safely dispose of your needle and place a cap over the syringe for transport. All specimens should be labeled at this time as well and placed into a specimen bag to be hand-delivered to the lab. Samples should not be tubed, as the containers can become compromised by the pressure of the tube and tunnel. Finally, take note of some of the incorrect entry points or approaches previously noted. While an infrapatellar approach can be used for injections or in the case of a prosthesis, the most easily reproducible procedure is that as demonstrated in this video. We thank you for viewing this segment of the South Pointe Orthopedic Surgery Residency Educational Series. We hope this video was beneficial and that you will utilize other videos from our series, as well as the correlating PowerPoint slideshows that expand upon each of the respective topics.